An annular drive-through sign can be defined as the possibility to introduce a 4 mm shaver in between the annular ligament and the radial head. This can be associated with a partial tear that we often recognize in the anterior aspect of the elbow. As we can see here, we are looking in the posterior compartment of the elbow with the arthroscope introduced via the soft spot portal and the shaver in the posterior lateral one. The shaver is easily introduced in between the annular ligament and the radial head. The second step of the procedure is to pass to the anterior compartment of the elbow. An anteromedial portal is created first to introduce the arthroscope, and via this portal we can appreciate very well the lateral compartment and the anterior component with the radial head and the capitellum. A limited anterolateral portal is created as well, and from this portal a probe is inserted and we can see very well a deep lesion or a partial articular sided lesion of the LCL in its radial component and with a free flap coming down from the capsule. At this point of the procedure we enlarge the anterolateral portal, and with the dedicated grasper we understand how the LCL in its radial component can be reducted to the bone. Then a dedicated 5 mm anchor is inserted at the level of the insertion of the ligaments, and progressively a suturing technique is planned. Sutures can be passed either with shuttling technique with a spinal needle inserted at the level of a radial capitellar joint through which we pass a PDS suture, and from this PDS suture we shuttle the sutures coming from the anchor through the ligament, or as an alternative, sutures can be passed with a retrograde suture passer through the ligament. Once sutures have been passed, they can be retrieved from the anterolateral portal and directly sutured. We can appreciate how the ligament is back to the bone, well secured. At the end of the procedure, we can go back to the posterior compartment to check how is the relationship between the radial head and the annular ligament. And at this point, we understand how the allotment is then reduced and there is no more annular drive-through sign.